Welcome. Okay, it's 7 in the morning, and I'm about to go see Dr. Yarnell. It's gonna take about 3 hours to get to Seattle from Portland. Here we go. Road trip.
I'm Dr. Yarnell, and I've been a practicing naturopathic physician for almost 16 years now. So I have a very unusual specialty in my clinic, which is that I focus on men's health and urology, and also somewhat nephrology or kidney diseases. Yeah, so I do accept preceptees or students observing my practice. I've had both naturopathic students, and also we have an herbal science undergraduate program at Bastyr, and I've had them sit in. So the reason I decided to have students observing with me was certainly in my own training. It was really helpful when I did that, and I appreciated it, and I saw that it was certainly somewhat of a burden on the people I observed with to do that. But also I feel like I want to really expand knowledge of men's health and urology, so I feel like, well, then I have to do this, I'm going to expand that knowledge. And also that I really love herbal medicine, and it's really important for me to kind of spread that knowledge. Definitely the three most common conditions I see patients that have would be prostate cancer, BPH, and chronic prostatitis / pelvic pain / interstitial cystitis. So this is about sort of my schedule and when I could have students with me. And I only practice in my private practice 1 day a week, which is on Tuesdays. I do supervise a shift at actually 2 shifts. One is at a cancer clinic we have at Bastyr, which I can have students at that as well. That's on Monday afternoons. And then my Bastyr student shift is Thursday mornings where I can't. So it's a typical day in my office. So I'll talk about the cancer practice as well as this one. And the cancer practice is urological and nephrological, however you say that word, cancers. So prostate is by far the majority, some bladder and some kidney cancer. And that one is part of a research program at Bastyr. So that has a kind of different flow where patients are filling out a lot of questionnaires and forms. In private practice on Tuesdays, actually the schedule varies widely from quarter to quarter because it depends on my teaching schedule. But typically I run from 9 to 7. And there's usually 1 or 2 new patients. I'll start with a new patient, and one part of it that often I think students have a question about is sort of what is their role and how do they know? And what I do is actually the student is with me, we go to the waiting room, greet the patient, I introduce the student, and I ask the patient right then, are you comfortable having the student sit in with us? Now this is particularly an issue when I have a female student working with me, which I've had many, and I'm obviously doing mostly men's health. It's only been a very few patients that have said they weren't comfortable. And then often what also happens with that is sometimes if we're doing a physical exam, the patient sometimes is not comfortable having the student there, so then the student can still leave but be there for most of the visit. So anyway, that's worked well. This may be a little tricky because it's harder for the patient to say no when the student is right there and they're confronted with them, so I do that on purpose. Okay. Yeah, just cut to the chase, we're all busy. So my advice is kind of students now and doing their thing. Wow, so many things. Well, this is going to kind of just be a random list. I don't know if these are in order, but one thing I think is really important is decide what you want to do after you graduate as soon as possible. You cannot wait until you graduate and do boards to figure out what you're going to do. I see that constantly, and it's not a good scenario. It's like you need to have a plan and you need to work towards it. If you want to do a residency, you target the residencies you want, find out what they're looking for, what you need to do. You know, do they want community service? Do they want good grades? What do they want? And do those things. Like build your resume to fit the positions you want. Also to really take care of yourself, and you get, I think all students get that message, but it's really hard to implement, but it is really important. And especially sleep. I see a lot of people let that go, and it actually impairs their performance in school. They think it's going to help because they're studying more, and it actually makes it worse because, when you don't sleep, your memory is worse, your performance is worse. And we're all going to tell our patients this over and over again. So I'm telling all the students it applies to us too. Read. Read, read, read. I think a lot of people feel like, well, all I have to do is go to class, listen to the lecture, do whatever's being done in class, pass my tests, and that's enough, and I'll come out. It's not. It cannot possibly be enough. You know, there is not enough time in the day in 4 years, even if you went to school 16 hours a day, to cover everything that needs to be done. So the only way to do that is to read. And the other benefit of reading is you get a diversity of opinion, which is impossible to get from live. Last kind of thing specific with being a preceptee and working in other people's offices is don't just sit as a passive observer. At least take notes and practice your, charting. But also think about, what would you do with this person? Before the doctor says anything about treatment, start thinking about what would you do? You may not get a chance to talk about it or anything, but that's forcing your brain to be engaged, and as opposed to just sitting there listening and falling asleep. So I really push my students to, and particularly to come up with the herbal formula they would give before I do it, so that then they can compare and think about that. Keeps their minds in the game. For them, it's definitely about whole foods, vegetables, nuts, seeds, getting away from processed foods. All these kind of pretty standard things are the most important for preventing prostate cancer. Vegetables, nuts. Big patient to illustrate this, which is this guy parks cars at a casino. And he's the oldest guy of the car park, because most guys are young guys, he's an older guy. And so he's got prostate cancer. And it's low grade, so I have no fear about it. But he's basically under all this pressure from these mostly teenagers to be cool. But he's like, well, I have to eat this vegetarian diet. He doesn't really like lots of meat, doesn't really agree with him. So he gets constantly ribbed for eating like a rabbit, basically. But he keeps doing it. He's stuck with it, and he's lost weight. His energy is better. His sex drive is better. His PSA comes down. Everything is better. So he just says, you guys can make fun of me all you want. Someday you're going to be in my shoes, and you're going to see you should have not been making fun of me, but emulating me. So yeah, I guess my summary would be that despite a lot of things, despite there's always going to be politics in any profession, certainly this one, that this is a great profession, that we are really helping a lot of people. The diversity of our profession is a strength, that we should not just go towards completely these sort of practice-based guidelines and evidence-based. Like there's a lot of room for diversity. And that this is a wonderful profession. I'm glad everyone is in it who's joined it, and that I think we're really making a big difference for how small we are in the world. So stick to it through thick and thin. It's worth it. It's difficult. There's no question about that, but it's worth it. I've gone through a lot of difficult times, but I've never regretted that I'm an ND, and I'm really, excited about our profession. I think we don't even know half our potential of where we're going to go, but it's going to be huge. So, power through. It's all good.
afford it.
And that's not all. And I,
Peace.